All right, guys, thanks for the next patient. And by the way, just so you know, we're doing things a little bit differently. We're filming this for an educational program, so there'll be people filming us. Don't worry about it. We're just continue on like how we usually do. Next patient today is Bart. He's from Tick Ridge, which is outside of Somerset, apparently. I didn't know that. But if you guys remember, so Bart, he's that 14-year-old child. He's a bilateral cleft lip and palate. It's been repaired. Other things that have happened, he's also had other surgeries, including posterior pharyngeal flap for his velar pharyngeal insufficiency. He came today, I think, complaining more about some other social issues as well. He's worried about how his lips and his nose look. He's got a little bit of bullying, it sounds like. We'll address that in a second, I think. Just some more background information on him. He's in 8th grade. Unfortunately, he's been held back a couple times. He's with his foster parents. His parents don't have actual rights to him anymore. And I think that's all kind of introduction. We'll kind of go through the other physical stuff soon. So I'll just sort of start out. He's got, on physical exam for me, he has a pretty scarred upper lip. His palate, he's got the pharyngeal flap that we can see. And actually, by the way, Amy couldn't make it today in speech, so she gave me her...
I was wondering where she was.
Yeah, she couldn't make it. She had other stuff she had to attend to. But, so in terms of physical exam, the lip is pretty scarred pretty badly. He's got pretty retreated upper maxilla, and I'll leave that to Larry, obviously, for oral surgery. And then his pharyngeal flap is really low set, so I don't know if it's functioning or not. If you guys are okay, I'll just read what Amy said. She said that he's got very florid VPI, or velar pharyngeal insufficiency. The video nasal endoscopy she did demonstrated scarred palate that's immobile, it's not moving, and pharyngeal flap is essentially not doing its job. So why don't we just kind of go around the table here for orthodontics, Dr. Klumper.
Okay, yeah. He's got crowding, but we've been kind of waiting to treat that, so we can kind of combine that with his orthodontic surgery, and that's wouldn't be too far off from starting that now, age-wise, but he needs to see Dr. Perez, and we need to get his mouth cleaned up. He's got a lot of gunk everywhere. He's not doing a very good job of brushing, and nor is his diet very satisfactory. So I'm hesitant. I don't want to start now for sure until he takes some ownership in his oral hygiene. And then when it comes time to move the jaw area, a little concerned about the pharyngeal flap as well. So right now we're kind of on a holding pattern.
Yeah, I agree with that. He's got about a centimeter negative overjet, which is obviously quite a bit, not uncommon for our patient population, but with this degree of VPI, certainly we're concerned about the procedures that we'll need to do to correct that. That's why, Amy's input I think is really important. He has had bone grafts, which feel like they've taken pretty well. I haven't seen an x-ray in the last year or so. You probably due for some new x-rays. I know that you have some comments on this patient, but I'm not sure he's ready for braces until he really gets some dental treatment and sticks to a program.
What do you think, Dr. Perez?
Sure. Yeah, I completely agree with Larry. This kiddo is 14, so he's got all his permanent teeth in. He doesn't have any baby teeth yet left, and we've got almost one cavity in each tooth, and that just makes it really hard. His risk is really high. His diet is awful, so he's full of soft drinks during the day. We've got to change the way he thinks. He's got to take ownership. I understand that his foster condition is complicated, so he doesn't have somebody that can help him out, with good habits. But I think it's time for him to just own up and make sure we have to give him information. We have to make sure that he knows what's good and what's bad. And once we get him in line and we can address, his diet, address the way he cleans his teeth, and we've got him in a good place, at that point, I think we should go ahead and do orthodontics and surgery when that's needed. But yes, he needs treatment. He's got all these caries. We need to get him seen somehow, some way, and somebody's got to take the time to talk to him.
So as far as hearing goes, based on his last hearing test, it's stable, but it has been a while since he's had a good hearing test, so I did that today. And hearing is stable, and I did a hearing aid check, but he isn't wearing it. He admits that he's not wearing it. So I'm really going to stress the importance of going to get routine hearing aid tests, hearing checks, and hearing test at the commission in the Somerset office to meet with his audiologist there at least every 6 months, and then she can monitor his use, and then I'm going to make sure that today's test gets sent to the school for his IEP so that the teachers know, what kind of hearing loss he has and why he's struggling, why he's struggling in the classroom because he's not hearing that well.
Did he tell you why he's not wearing his aids?
It probably has a lot to do with the fact that he doesn't like how they sound because he's such an inconsistent user. If he could, I talked to him about, wearing them an hour or so a day and then gradually increasing that so his brain gets used to sound again. Because when he puts them on, they are loud. He's not wearing them. But if we can get him, if he can do that, and I talked to this foster mom about that, some type of reward, if you do that for a while, then we'll get you this, something so that he sees, the value of them after wearing them for so long.
That's going to affect his speech therapy too, right?
Yeah,
If he
Yeah.
can't
yeah,
hear.
if he can't hear.
Yeah,
right?
if he can't hear, he can't talk.
Total development.
The other thing too, like we all know, for all these teenagers, he can never keep hearing anything. They just
Yeah.
are so embarrassed with them.
Yeah, that's, that's the opinion. He didn't want to say that, but
Yeah.
that is definitely, and self-confidence comes from, the home, and where the home is kind of
Yeah.
not stable, that can be affected too. So maybe social work can talk about that too.
Yeah. What do you think, Bill?
Excuse me. Well, yeah, he definitely has a real low self-esteem. We've identified that, and there's a history of some behavioral issues there, and he's been put on medications, but there's really no follow-up there. He's not been linked with any counseling services ongoing.
So just to break it though, so he's on Risperdal and Adderall, right?
He is on Risperdal, but he's not always compliant with these meds. He's in a new foster home. He's been in and out of a couple, so he really hasn't had that consistent reinforcement in the home, which is definitely something he needs. He has the speech issues, which is causing him additional frustration with peers and lowering his self-esteem even more. Gets frustrated leaving the poor choices, so we'd like to get him definitely linked with some additional counseling services, get some additional structure within the home, talk to the school about some options that might be available as far as some reinforcement. I know we've also had some older patients with cleft lip history that have done well with the program, that have progressed through similar difficulties, and we could link him with a peer there, an older peer like a mentor that could work with him and maybe talk to him about some of those feelings and help move forward.
Okay. Physical therapy.
Yes, he also has a weight problem, also probably due to his poor diet and lack of inactivity or lack of activity. I would think it would maybe even be a good idea to refer him to a dietitian or nutritionist to help with that. I'd like to refer him to outpatient PT, possibly closer to his home, and get him started on an exercise program. And one good program that has been helpful with patients similar to him in the past has been pool therapy. And if we can link him up to that in his hometown, which very often the physical therapist will meet him at the pool, it increases compliance, it's fun, it's low impact on the joints, and it helps a great deal with weight loss, that plus the diet. I'd like to also collaborate with his school, with his IEP, and see if they could do an adaptive PE program that could give him more activities during PE that would help to improve weight loss and get him more active. And maybe even refer him to a community agency like the YMCA and do a good checklist with him of what his likes are so that we can link him up with activities that he enjoys doing. And that way he would also be more compliant. Find out if he likes any particular sports, if he likes other activities. Even an after-school program, as Bill was saying, he's feeling bullied at school and he's maybe with the wrong friends. And if we can get him into an activity that he likes to do, even if it's not a sports-related activity, music, drama, anything after school, just any type of group, would keep him off the couch and more active in the community, and I think that would improve his self-esteem and help with weight loss.
So, get all that, Gene? Just kidding. So we got a big problem. You know, he's complicated. We got a lot of issues. The other thing too that I think we talked to pharmacists about is Adderall and Risperdal, and obviously that's probably causing some issues with weight gain and feeling, and also issues of compliance because from what I understand he doesn't like taking them. That's understandable since it kind of makes you get out of it. The other thing too is that we didn't really address, actually, the foster parents are saying that he snores quite a bit and he's having apnea. He's tired in the morning, unable to pay attention at school. So we got to sort of kind of, he's got a lot of things we got to take care of, right? And something we could obviously do simultaneously, but I think just because it's easier for me to visualize, when we tackle some of the medical issues first. So so we're all on the same page, guys. So it looks like things that he needs, and just kind of keep me on track here. So he needs a sleep study. He needs mandible and maxillary films. He needs counseling services. He needs PT, nutritionist, dietitian for his diet, and then he needs a dentist, obviously. And then ideally also gets a full speech eval. Am I missing anything? Does that sound good?
That's good.
Yeah, but I'll tell you, the only problem I see with that, any of y'all been to Tick Ridge lately?
No.
I don't think any of those services are available for Tick Ridge.
Tick Ridge near Somerset, that one.
Either one, the Tick Ridge I'm familiar with is near Somerset, and none of those services are available.
Well, that's a problem.